Now we're going to go. So we talked about the hypothalamus and the anterior pituitary. Now we're going to talk more about the endocrine glands that are around the body. So first one is going to be thyroid gland. I mentioned it a couple of times. It's a gland that kind of looks like a butterfly. It's just below or inferior to the larynx. So you have the larynx here, and then the thyroid's here. So this kind of butterfly shaped organ right here. It has what we call two lobes, and then there's an isthmus that's going to connect the lobes. So it's kind of this little island in the middle that we see. And then this is going to be the right lobe and then the left lobe. The thyroid gland has follicles in it. So you can see this big bubble right here is actually a follicle. And you look at it histologically. And you have the follicles that are going to, these cells that are going to produce thyroglobulin. So we'll look at thyroglobulin later. We also have colloid, which is going to be thyroglobulin plus iodine. So thyroglobulin plus iodine is the precursor or the ingredients to make thyroid hormone. So colloid is going to be thyroglobulin and iodine together, and that's what's filling up the thyroid follicle. So that's what's inside here. And again, without iodine, we can't make thyroid hormone. So you absolutely need iodine to make thyroid hormone, and you need thyroglobulin. The parafollicular cells, so around the follicles, so big follicles, we have these kind of cells that are packing in between. These are the ones that we say produce calcitonin. Remember calcitonin from your skeletal system, where it responds to high calcium levels. So if you have high calcium level, calcitonin is released to bring it back down by increasing the urination of it, increasing the defecation of it, and storing it in bone. Iodine, again, iodine ions from diet, so it's something that we can't produce, you must get it from your food, are going to be brought to the thyroid glands. And then that's taken up by the follicle cells. So iodine, it's iodide and iodine, kind of different variations, but iodide ions come from being absorbed in your intestinal tract and capillaries to the thyroid to go to the follicle cell. Enzymes are converting it iodide to iodine and then attaching them to that thyroglobulin. So you're just using iodide and iodine to make thyroid hormones. But the point is you need iodine to make thyroid. So you have two forms of thyroid hormone. So you're going to have what we call T3 and T4. Both are going to have the kind of thyroglobulin or tyrosine molecules, but they're going to be the 4 and the 3 are the amount of iodine atoms. Yeah, it shouldn't be molecules, it should be atoms. So the amount of iodine that you have makes it a T4 or a T3. So T4, we call it thyroxine, and that's going to be 4 iodine atoms. And T3, we call triiodithyronine, thyronine is going to be 3 iodines. That makes it the T3. So follicle cells are going to remove, so this is thyroglobulin, and your iodine is going to be inside the follicle. So that's going to be your colloid, remember. Then the cells on the outside, so the fall follicular cells, are going to actually take in and remove the thyroglobulin from the follicle. So it's going to take the thyroglobulin back inside the cell by endocytosis. Enzymes are going to break down thyroglobulin and make it to use the thyroid hormones, be those released, and then everything else from the thyroglobulin is going to be recycled to make it again, so you can have it again. T4 is going to be most often the one that's released, but we do release T3. And by diffusion, because remember, we're an endocrine gland, it goes directly into the bloodstream. Our hormones are going to go directly from the follicle cell into your capillary and into the bloodstream to go wherever it needs to go. T4 and T3 travel in the blood because remember, they are water soluble because this is amino acids, this is protein derived, but they need to be traveling with transport protein. So I saw in this, there's this transport protein that it'll attach to take it throughout the bloodstream. As those proteins are holding on to the T4, T3, then they release it gradually as they go around. So it can take kind of a while for a burst of T4 or T3 to be released into the target cells. So we say the bloodstream actually contains about a week's supply of thyroid hormone. So if you were to have a decreased amount of thyroid hormone being produced, you can at least last a week to have it be released from these proteins slowly to give you enough thyroid hormone to last a week before you start having issues. So just looking at an overview. So again, we have iodine that's converted to iodine. So you have iodide atoms, iodine. Iodine has to be used to make T4 or T3, depending on if it has 3 iodine atoms or 4. Thyroglobulin is kind of component, at least when it's in the follicles, goes back in. You break off part of the part that's the thyroglobulin and recycle. And then you have T3 and T4 that diffuse in the bloodstream and are carried by proteins. Don't need to worry about the binding proteins name. So now that we've gone over how thyroid hormone is made, kind of briefly, the effects of the hormone. Thyroid is needed for almost every cell in the body because it's going to be increasing your metabolic kind of reactions. So it goes into target cells, which are pretty much everywhere. And again, remember, this is the weird one, though, even though it's water soluble, it can go through and go in through carriers into the cells. So it has intracellular receptors. And it goes not only inside the cell, but it goes into the nucleus. And remember, if it was an intracellular component, intracellular hormone, then it's going to have an impact on genes and protein synthesis. So what's going to happen is the effects of thyroid is going to increase the metabolic rate. So it also goes to the mitochondria to increase ATP production. So if you're increasing ATP production, to make ATP, you have to have oxygen, at least to make a large amount when you're in the mitochondria. And so then you're going to have more ATP and you'll be able to use more ATP. With all these chemical reactions occurring, this is helping with heat production inside your body. So it's actually helping maintain your temperature so that you feel warm. Because of having all these chemical reactions, they release heat. So more chemical reactions, the more heat production that you have. Thyroid hormone is also needed for kind of synergistically working with growth hormone. So regulates tissue growth and development as well. So everything is kind of increased with thyroid hormones. You increase your oxygen consumption, you increase your nutrient consumption because you're making more ATP, you increase your heat, you increase everything. So it's all metabolism up. Thyroid hormone also helps maintain your blood pressure. If you are increasing your heart rate, it has an increase effect on your heart rate and it increases the force of contraction. Well, remember, kind of if you have a stronger heartbeat where you're getting as much blood out, so you are increasing your stroke volume and you're increasing your heart rate, well, you're increasing cardiac output. Increase in cardiac output will increase blood pressure and help maintain it. If you're having your cells and thyroid hormone is going around and it's increasing the rate of oxygen consumption, well, what's carrying oxygen around your body? It's red blood cells. So it's going to increase the amount of red blood cells that you have and stimulate division and making a formation of red blood cells because your cells are using more oxygen and want more oxygen. And the way to get it to the cells, to get the oxygen to the cells, is through red blood cells. You're going to stimulate protein synthesis. Again, you're going to activate specific genes, and then you're going to activate protein synthesis. So you're going to make enzymes and other kind of proteins, whether it's mechanical proteins or enzymes. You're going to increase motility or enzymes with catalytic reactions. So you're going to increase proteins in the cells. Because you are increasing your ATP production by using more oxygen and using more nutrients. So you can use glucose or fatty acids that are actually converted into glucose to make ATP. So glucose is needed for reaction in the mitochondria to make ATP. So you increase using your blood sugar, your glucose, and fatty acids to make it. You can increase what we say the turnover of minerals in the bone. So it can increase kind of remodeling of the bone. So looking at that. And it can also have an impact on other endocrine organs as well. Mentioned this before, thyroid hormones regulated by negative feedback. So if you have a low T4 or a low T3, both T4, then that is going to stimulate the release of TRH and TSH. So if there's low T4, then you want to stimulate the thyroid to release thyroid hormones from the anterior pituitary. TSH will have an cause more release of T4. If you have a high T4, then you're going to have more the inhibitory effect, where you're going to stop the release of TSH and stop the release of TRH. So I've seen this before. Hypothalamus, TRH, anterior pituitary, TSH, thyroid gland produces thyroid hormones. If you have high levels, then you're going to stop TSH production and stop TRH production. So then you stop the stimulation of the thyroid. If you have too low, then you're going to increase. You're going to increase your TSH level. You're going to increase your TRH level. Whatever you need, whether there's too much or too little, then the anterior pituitary and the hypothalamus are going to respond accordingly. Just looking at some disorders of the thyroid. So first is going to be hypothyroidism. So when you have hypo, you have too little. So if you're having too little T4 and T3, then you're going to have everything kind of slow and sluggish. So I call it the tortoise and the hare kind of diseases. So this is the tortoise. So everything's slow. You have a low metabolic rate, so you can get heavier. Whatever calories that you are eating aren't being used by your cells, so you can have low metabolic rate. You can have thicker skin, and it's drier. You're gonna have swelling. You're feeling chilled because your thyroid's involved in heat production and keeping you warm. You're constipated, so increase or decrease defecation because of the low metabolic rate. Defecation isn't happening as much. Swelling. If you don't have the metabolic kind of rate, then you can get kind of foggy or sluggish and very, very sleepy because you just don't have the energy that your cells need. This can be because of many different things. Sometimes we have it where we don't know why it happens. Sometimes it can be autoimmune, where your immune system's actually attacking your thyroid tissue, and kind of less likely in the United States because we're developed and we add iodine to salt and things like that. But in other countries, if the diet's not proper and you have a lack of iodine atoms in the diet, because remember, without iodine, you don't make thyroid hormones. So we say a goiter may develop because the thyroid really, really wants to make and is being stimulated by TSH. So with hypothyroidism, you're going to see a high TSH. And high TSH and a low T4 diagnosed. So that's going to be TSH is going to continuously try to stimulate the thyroid, try, because that's the job is to stimulate it. Well, you can't make thyroid hormone. So the thyroid gets larger, but it just can't make the proper thyroid hormone because there's not enough in the diet. Hyperthyroidism is the hair kind of version. Everything's increased a lot. So it's too much T4 or T3, too much thyroid hormone. This can also be an autoimmune disease. And what happens is the body actually makes antibodies that are weird or abnormal. And these antibodies actually act as if they're TSH and actually stimulate thyroid hormone release, even though they're not actually TSH. It's not coming from the anterior pituitary. It's just close enough that it mimics TSH. So just like with hypothyroidism, everything is low and slow. Hyperthyroidism, everything's up. So this is the hair where metabolic rate, you can eat and eat and eat and eat and eat, and you're still losing weight because your metabolic rate is so high. Always sweating, your heartbeat is up. Sometimes you can get an arrhythmia, so you can have an abnormal heart rate or heart rhythm, I should say. Nervous instead of sluggish, and then eating all the time and losing weight. So it's the hair portion of the tortoise and the hare. Calcitonin, remember, is produced by the parafollicular cells, so around those follicles, and that responds to high calcium levels. Not a common condition, but it does occur. It's the antagonist to parathyroid because parathyroid responds to low calcium levels and calcitonin responds to high. So they do the opposite effect. So calcitonin is going to inhibit Osteoclasts, remember those are the bone chewers. And so less bone chewing, less calcium being released into the bloodstream. You're going to stimulate, so less chewing, the blasts are going to continue. So osteoblasts are going to continue building bone because they're the bone builders to take that calcium from the blood and put it into the bone. It's also going to increase urination of the calcium. So you're going to increase it in your urine, and it's going to decrease absorption in the intestinal tract as well. So whatever way we can get rid of it, if you want to pee it out, if you want to poop it out, or store it in bone to get that calcium level back down. Parathyroid gland, again, is going to be the opposite I talked about, where it's around the thyroid. So the parathyroid is also kind of all around here, little different parts embedded in the posterior section of the thyroid. That's why if the thyroid gland needs to be removed for some reason, like thyroid cancer, everyone's surgeons have to be very, very careful not to remove the parathyroid because then you're messing up your calcium homeostasis. So very closely associated, have to be very careful to leave those if there's some reason removing the thyroid gland. So they're producing parathyroid hormone. Again, that's in response to low calcium levels. So this is going to be, again, stimulating osteoclasts and inhibiting osteoblasts. So you're going to chew bone, release calcium from bone. You're going to decrease it in urine. So you want to maintain and reabsorb your calcium. And you're increasing your intestinal absorption with the help of vitamin D. So again, it works with calcitriol, which is going to be activated form of vitamin D that happens in the kidneys. Parathyroid hormone, if you have going back to normal levels of calcium, so you've responded to the low levels and you're back to normal, well, then you're going to stop releasing parathyroid hormone. Again, skeleton, so we're going to break down bone. We're going to increase its reabsorption in the kidneys and increase its absorption in the intestines. So you're going to stimulate osteoclast to chew bone, so release calcium from the bone. You're going to make sure that calcium isn't urinated out, so it's going to be reabsorbed or kept by the kidneys. And you're also going to make sure vitamin D is made into calcitriol. And calcitriol, again, is going to have more increased absorption of calcium by the intestines. I don't know why that repeated. So this is, again, just looking at calcium homeostasis. We like it to stay between 8.5 and 11 mg per deciliter. So you have decreased blood calcium level, then you're going to have parathyroid hormone released. You're going to make sure the kidneys keep calcium, the bones release calcium, the digestive tract absorbs calcium.